Thank you, Rick. So Medicaid expansion is likely to be an important topic of discussion in the upcoming legislative session, as everyone here is well aware. And what we wanted to do is take advantage of the existing data that's out there. At this point, we have a number of states, 36 states that have taken Medicaid expansion. We have 14 states that have not taken Medicaid expansion. And at this point, that enables Wisconsin to have the benefit of hindsight. We can look at the data and see what has happened in the states that have taken expansion in comparison to those states that have not taken expansion. We wanted to look particularly at two potential topics. We wanted to look at private sector healthcare spending. Private sector healthcare spending is the expenditures by insurance companies for hospital visits for any sort of care that an individual might have. And then we wanted to look at ER visits. So the idea for Medicaid expansion supporters tends to be that if we have Medicaid expansion, individuals will utilize more preventative care and utilize less of this expensive care, things like emergency room visits. So we gathered data from all 50 states going back several years, and we included a number of control variables as well, other factors that could potentially affect the cost of medical care in a state, as well as the number of ER visits that people might engage in. And then we compared over time what's happened in these states relative to, or what's happened in expansion states relative to non-expansion states. And what we found is that private sector healthcare costs increased in Medicaid expansion states by about $177 per person more in states that took expansion relative to states that did not. So this, for a family of four, this could be a cost of as much as $700 per person, or excuse me, per family. So this is a meaningful increase in cost potentially. In terms of ER visits, contrary to the popular narrative, what we saw is that ER visits increased by about 9 per 1,000 residents. And when you extrapolate that out to the entire state of Wisconsin, this could be an increase of nearly 50,000 ER visits over the course of a year in the state. So why are we seeing these things? Well, if we see people taking advantage of more expensive care, Medicaid reimbursement rates are significantly lower than private sector reimbursement rates. So when we're moving people from subsidized care, those that are currently covered up to 138% of the federal poverty limit under the ACA, to fully subsidized care, or very close to fully subsidized care on the Medicaid plan, the reimbursement rates are significantly lower. Hospitals and healthcare providers tend to pass those costs along to consumers. And Noah Williams is here. He's going to talk about some of the broader implications for the state.
Thank you. So in addition to our point estimates, we wanted to boil down and try to look at what is the overall costs and benefits associated with potential Medicaid expansion. Lots of the discussion about the possible Medicaid expansion has been focused on the savings to the state through reduced government spending, reduced state general purpose revenue going towards health spending. In addition, there would be funds provided by the federal government, which would go towards increased medical spending. Altogether, as we see in the chart here, that would total about $545 million. So that includes, again, both the direct expenses by the federal government and the increased reimbursement by the state. On the other hand, though, if we look at the costs, our estimate of the costs adjusted for inflation comes out to over $1.1 billion per year. So the total of $545 million that we would be getting from the federal government would then be shifted, lead to increased costs for private households of over $1.1 billion. So if we look at then the net costs, or the net costs or benefits, we find that the cost to the state would be roughly $600 million per year. So although all the focus has only been on the savings to the state through the increased federal revenues, this would represent a substantial shifting of costs onto households, onto people who already have insurance and people who are already paying a substantial amount for their insurance. We would expect to see insurance payments go up, and as Will mentioned, this is largely driven by the fact that providers would be shifting the costs onto those with private insurance. Part of the reason why the costs we would expect to be high in Wisconsin is because our uninsurance rate is already so low. Only roughly 5% of the population in Wisconsin is uninsured, and there is no gap. There is no insurance gap. People who are not on Medicaid are already eligible for subsidized insurance through the Obamacare exchanges. So expanding Medicaid would largely lead to a shifting of people from private insurance onto public insurance, onto government-run healthcare, and this would lead to, we estimate, a substantial increase in costs per year. So overall, we think that the net costs are substantial, and the solution to containing health costs and expanding access for medical care for all is not to move people from private insurance onto government-run insurance, but instead to provide more flexibility, to provide deregulation, to provide more variety in the private market, which will lead to transparency, incentivize people to control costs, and lead to lower overall expenditures. So again, overall, those are our findings. We find substantial costs associated with the potential increase in Medicaid expansion. I now want to pass the microphone over to some of the representatives and senators from the state government, and we'll start with Representative Sanfilippo.
Thank you. Thank you very much, and I greatly appreciate you gentlemen working on this study, because we've had this debate ongoing for quite some time. But I think it's important to remember that the people that are pushing for the Medicaid expansion really are having a solution in search of a problem here. Wisconsin does not have a coverage gap, and I think that's an important point to bring into the equation here, because most of the other states, in fact all the other states according to the Kaiser Family Foundation, have gaps in coverage, and that includes states that have already taken the expansion. So what we're doing here is we're trying to invoke a government-run program into something that isn't working well. And I think the reason that you have it is you have a group of people that want the money that comes along with it. They're addicted to spending. They want to feed that spending addiction at the expense of the health of the citizens of our state, and I don't think that we are going to stand for it. Thank you.
Well, good morning, everyone. Thanks for being here. I'm thrilled that Will took the time and effort to take an analytical approach to what is going on in the state and what the potential impact of the Medicaid expansion is. So far, for so long, we've just heard numbers thrown around and, hey, everybody wants federal money, right? I mean, that's what it's all about. Well, as we found more and more and more, that the strings that come with federal money often make it not worth it. And here we've got a very credible analysis that really points that out very clearly to us. The part that I never understood was, okay, Obamacare was the next best thing to slice bread, and this gap between 100 and 138%, where we want to expand Medicaid to, they're covered by Obamacare. There's big federal subsidies that are available. It's how Obamacare was designed. So why the need to offload this to the states? Well, I guess if you're a federal government and you're $22 trillion in debt, I can see why. But, the discussion of the 90% share right now, when all the rest of our Medicaid co-pays are at 60%, where this is going to go. So it's, again, I'm really happy that we've got an approach to this that is methodical and it's analytical, and we can really see where this is going to end up. Ultimately what it does too is it moves more and more people to government insurance, and that is, by another term, could ultimately end up as single payer, and then that becomes socialized medicine. And so we need to keep the private sector involved in the health insurance business. That is where we see the best results. And again, if we don't go the private sector with health insurance, we end up going the public sector, and that's private payer, that's socialized medicine, and that never ends well. So this is definitely a push in the right direction, and I appreciate the work of Will on behalf of this issue. Thank you.
All right. Senator Chris Kappinga, 33rd Senate District. The reason I came is because I really appreciate Will, being a numbers guy. I love statistics and backing everything up with facts, because you can't argue with the numbers. And they kind of laid out the case that we as legislators have been making since the beginning of this discussion, where it doesn't make sense to put the taxpayers at risk, number one. Number two, how many times have you seen somebody go from private insurance to Medicaid and jump up and down and go, oh, yippee, I'm so excited to be on Medicaid? It doesn't happen. I would much rather be on private insurance and be subsidized than be on Medicaid. If you look at quality of care and all the statistics around that, it's not something that people want to get into. The other thing is, just from my perspective, I have to represent my constituents. And I look at the significant cost shift, which we knew was there, but now we can actually put some numbers around it. The significant cost shift that takes place to private citizens. And one of the number one things that we hear from constituents, and it doesn't matter what district you're from, is the cost of health care continues to go up. What are you going to do about it? And my response has always been, the problem that has been generating so much increase in cost goes back to the ACA. It's not helping control costs and making things more affordable. And the last thing we want to do is take what Will proofed out in their studies, and they said, listen, this is going to shift over to the regular citizen, the people who are out there working. It's going to shift the cost over to them and increase what they're already struggling to pay. And it's a great statistic to go to and say, I can't do that with a good conscience and continue to shift that cost over to the citizens that I represent. So I wanted to thank Will for the great work, love the numbers, and with that, I'll just hand it over to Senator Dave Craig.
Good morning. Dave Craig, 20th Senate District. I appreciate what Will has done here in analyzing the real data that, as they said, comes from experiential learning from other states and how this is not working. Time and time again, we heard about the great results that would be had by the ACA and expanded role of government in healthcare that has not come to fruition. You were supposed to be able to keep your doctor. We've now seen individuals having to leave their physicians, which they've been for lifetimes. They've left their insurance policies, which they were guaranteed they'd be able to keep. At some point, we as legislators here in the states need to realize that we have a federal system, that the states comprise the federal government, that the federal government shouldn't dictate to the states. We have to realize that as the government continues to involve itself more and more in healthcare, that Ronald Reagan's old adage that as government expands, liberty contracts will continue to be truer and truer as time goes on. The idea that government decreasing in any way, shape, or form the cost curve in healthcare is now firmly laughable, because at every possible situation where government has expanded, the cost of care has gone up. These numbers show that. These numbers show that as government might expand into the Medicaid realm, that as this program would expand here in Wisconsin, undoubtedly less individuals would have the liberty to contract, the liberty to have an insurance product in the private realm that they could privately contract for. These are not results that are favorable for anyone. Not a taxpayer in Wisconsin, not an individual who's looking for quality care. I continue to look forward to looking over the report from Will and developing good, sound public policy that actually addresses the underlying problem that we in Madison and in Washington, D.C. should be addressing, the cost of care. Thank you.
I just want to reiterate, this was a joint project between the Wisconsin Institute for Law and Liberty and the Center for Research on the Wisconsin Economy at the University of Wisconsin-Madison, where Noah Williams is a tenured professor. Dr. Flanders and Dr. Williams are now available to answer questions. If anyone has any questions, you could ask me a question about it too, but I can't do math, so I probably won't be able to help you very much. But if there are any questions at all, we prepared to answer them.
Does the study assume that with the additional federal money Wisconsin would get, it would not follow back into reimbursement rates? But obviously, if they increase reimbursement rates, it offsets some of the costs you're talking about, private insurance, correct?
So ours is a very conservative estimate in that we did take into account the LFB's reimbursement rate data. We know, as an aside, that reimbursement rates may not stay at 90% in the future, right? There's the potential for moving to a blended rate. There's the potential that problems at the federal level may lead to a reduction in that rate. But the positive side that you see there is the data from the LRB on what would be the effect on the state budget, and that is the positive side that you see there is the higher reimbursement rate.
There are a couple Republican states, and Oklahoma might be one of them, that are exploring Medicaid expansion.
Is there anything specific to Wisconsin that, in your mind, makes it not wise to pursue Medicaid expansion in this state compared to situations in other states?
So I think one of the most important points that was brought up by the legislators and Dr. Williams is that we do not have a coverage gap in Wisconsin, that every person in the state is either eligible for Medicaid up to 100% of the federal poverty limit or a subsidized plan. And that's a pretty heavily subsidized plan in that 100 to 130% of the federal poverty rate range. I think some of the implications here, because we use national level data, could apply to other states, and that cost number per person is actually a national number. It applies sort of across the board on average, but there are certainly unique circumstances in other states that might lead to different outcomes. But the lack of a coverage gap here, I think, is one of the most important points.
A question for the senators: is it fair to say that for the three of you, this is a red line, that there's no way you vote for a budget that included Medicaid expansion, or is it conceivable that there could be some deal where you could accept anything like this?
I think that, number one, you never say never or definitive on a single issue in the budget. The budget is cast full of all kinds of things, so we don't know, especially until we have a final product in front of us. But I think all of us have made it very clear that we do not and will not support Medicaid expansion. And again, the study that was just done is so beneficial for us to have this now, because we can actually lay out numbers where, prior to this, where sometimes reporters would ask us questions, we didn't necessarily have hard numbers. And so now we can say, hey, we've got hard numbers here based on experience. So this, if anything, further supports the position that we have consistently taken with Medicaid expansion is not good for the state.
Yeah, I mean, I think Chris said it well. I mean, we have a $76 billion budget that undoubtedly is going to grow under the governor's proposal. At the end of the day, you have to be able to do the math and provide funds. So any debate, question, or deliberation about the budget has to be done in its totality. So no, there's not a firm red line on any single issue, but I think we do need to take into perspective the size of the state government as it stands today over the course of the next 2 years, and see what that does going forward. We have a system in government here in Wisconsin where we have base year doubled, and that system continues to grow our budget time and time again, and that'll undoubtedly grow under the Evers administration.
Any other questions? If no other questions, thanks everyone for coming, and please do take a look at the studies that are back there on the table, and we'll also be around here for a few more minutes if anyone wants to speak individually. So thank you very much.